Good afternoon or good evening. It's my pleasure today to give you a quick demonstration of the ANARA software and how it works. As you have just seen, and I'm pleased to see from the discussion that there's a lot of interest in the software and the security of the data. So hopefully I'll be able to show this to you in my quick demonstration of how the software works. So first of all, it's important to know that the data capture is incredibly easy using the software. ANARA makes use of state-of-the-art software that, like Prof. Dyer has said, was donated from Latin America, and it comes with 30 years of experience and development into how the software functions and works. Importantly, the software is internet-based and therefore is available 24/7, not only for the purposes of data capture, but also for the use of the software during consultations or whenever the embryologist or the clinicians want to access the data for their own purposes or for their use. And very importantly, it's as easy to capture robust cycle-based data, probably in about 3 minutes flat. And hopefully I'm going to show that to you in a minute. So I've divided the data capture process into 3 steps. And the first one is the login process, which is via the ANARA website, www.anara-africa.com. And like with any website, all security websites will have login credentials and a password, which centers will have to keep confidential to themselves and only divulge these passwords to people who need access to the registry. So that's a very important first part about getting into the software. Secondly, I think Prof. Iman briefly mentioned that there are two main routes for data entry, and that is A with the manual data entry, and secondly with the Excel data upload. And both of these data capture methods capture cycle-based data. So firstly, from your homepage, when we are capturing data manually, we will quickly go and we click on the cycles that we've already captured. Here we are looking at our fresh cycles, and you can see at the top in the software, we're going to capture a new fresh cycle. And anybody that has used an internet form before will be able to capture a cycle very, very easily. It's as easy as clicking the forms and filling in all of the options that are pre-filled in the forms. So in this case, we are capturing a cycle where there was a total cryopreservation. The patient's date of birth was 1984. We don't necessarily need the actual date of birth. We fill in some demographic data about the patient. We capture some data about the causes of the infertility, and like we mentioned earlier, just brief information about the stimulation and the medications that we've used. Very importantly, we capture data about the number of oocytes we've retrieved, the number of oocytes, the type of insemination, the number of oocytes inseminated, the number fertilized, and as you can see along the way, there are options for capturing data about pre-implantation genetic testing, as well as the numbers that are cryopreserved. And that is it. I think that particular cycle took us just under 2 minutes to capture. So it's as easy as that to successfully capture a cycle. In the next slide, the third part of capturing data is that occasionally there will be errors that due to human error, that creep into the data. It's not that we're necessarily capturing these data incorrectly, but on purpose. But there are some validation methods that are built into the software where it will not allow us to capture an incorrect cycle. And it will throw out an error message that shows us that in this particular cycle, we retrieved 10 oocytes, we inseminated 9, but we fertilized 17. So obviously the software knows that we probably incorrectly typed in 17 and we should have typed in perhaps 7. If we go back and correct that, we can see that it now accepts the cycle as being successfully created. So there is inherent data validation within the software that makes it very easy, A, to capture the cycle, and B, to have a bit of quality control in terms of our data capture. So like I said, easy as 1, 2, and 3. And more importantly, or as importantly, I would say, is the use of the data. And from your data center homepage, you can go to a section called See My Data. And in an interactive manner, you are able to see the data of your center, of your country, and of the region, and specifically by different, according to different outcomes that you're looking for. So in this case, we're looking at all the fresh IVF ICSI cycles done in my center, in which case we had, I think a second ago, 120 cycles. There were 151 embryo transfers, and a clinical pregnancy rate overall was 31%. It also tells me that I had 30 deliveries with a delivery rate of 19.9%. So we can take this even further, and we can even go and look at our data based on the age of the woman. So it gives us the data stratified by woman's age, and we can see the different clinical pregnancy rates by the different ages, as well as our clinical pregnancy rates overall. And the final part is to use your data when you are in consultation with the patient and you've got someone that is undergoing fresh IVF ICSI. She falls within the ages 31 to 34. You want to transfer two embryos electively. You can go back to your own center's data and you can see, actually, I've done 12 of these particular cycles in my center. I had 8 clinical pregnancies and 4 deliveries from this data and 4 babies born from that. And I can tell my patient actually in real time, of course, that at her age, 35 to 39, her clinical pregnancy rate in my center would be 31.9%. Her chances of a delivery are 20.3%. And again, her multiple delivery rate in this particular center is 0. So we can also stratify that data by number of embryos transferred. And in future, we'll be adding a function where data can be stratified by elective and non-elective single and dual embryo transfers in graphs. So in a nutshell, that was just a quick demonstration of the software, of how easy it is to capture a cycle, B, how easy it is to edit and correct errors within the software, and finally, how easy it is to access your own center's data and how to use it both in the clinical setting as well as in the laboratory setting for laboratory purposes. Thank you, and I'm happy to answer any further questions.